By the end of this video, you will understand criminogenic risk and need as part of screening and assessment, and how your program's goals will demonstrate this requirement.
Thinking of the same client or another client that you have worked with recently. When the client sat in your office for intake assessment or your initial appointments, what screening did you automatically reach for that every single individual in your program receives? Is there more than one? How about assessments? What do these tools tell you about his criminogenic risk and need? What don't they tell you?
Taxman and colleagues suggest that, in providing services to offenders, there is nothing more important to staff than matching an offender to the specific services they need. The use of standardized, objective, and empirically validated instruments is critical to this matching process. In other words, screening and assessment is a key aspect to reducing recidivism. These instruments are a tool to support professional discretion and judgment in matching individuals to services.
After completing a screening and, as indicated, an assessment, you will have a risk level, high, moderate, or low, and which of the 7 dynamic factors the individual is exhibiting in order to match them to specific services. Not only will this information help to maximize the use of limited resources by concentrating programming on higher risk individuals with whom they can have the greatest impact, but you will protect lower risk individuals from more destructive behaviors of higher risk individuals and avoid jeopardizing pro-social relationships and productive community engagement they may have. This sentiment is shared across evidence-based criminal justice researchers. In order to ensure continued accurate classification of risk, reassessing individuals is key, as well as a requirement of state code. The types of screening tools and assessments will be determined by state recommendations and your program leadership. However, let's take a look at a few guidelines from the Pew Center to support implementation. Each instrument must be validated to ensure that risk classifications accurately represent the likelihood of reoffending among the group for which it will be used. Tools should be available, standardized, and routinely used. In other words, a regular procedure within the program. Staff should have consistent access to training opportunities and support from management, and management should be tracking the degree to which screenings, assessments, and treatment is affecting the risk level of those served.
To know what type of tools will best fit your program, you should know how to answer these questions. Who do you serve? What are your program goals? And just as importantly, who do you include and exclude from services? These questions and the answers should be embedded in your program's policies and procedures and shared with all staff members. This will make it easier to ensure that the tools you use, whether it is a screening or assessment tool or curriculum, are the best fit for those you treat. As mentioned before, good practice is to validate your tools to your population regularly, or select a tool that has already been validated with populations, settings, and similar definitions of reoffending to your program. Your program will likely require multiple screens and assessments in order to get a full picture of the individual you intend to treat. When treating criminal justice involved individuals, it is not sufficient to solely utilize screening and assessment of mental health and/or substance use. Remember, criminogenic risk and need has been proven by research to be tied to the likelihood of reoffense.
In summary, the main points that you should take away from this module are to select the right screening and assessment tools for your program's goals and to match the needs of the clients you serve. If you provide treatment to criminally involved individuals, these should include criminogenic risk and need. Have staff members who have been specifically trained to administer them for every single individual you are treating. Share, reassess, and utilize throughout treatment and after to know if your program is targeting what you intend it to.
In the next module, we will be discussing responsivity, the third aspect of the R&R model.